Good afternoon, everyone. It's afternoon here in sunny UK. That's a bit of a joke in itself. I'm looking forward to 4:30 when Man City play Arsenal. I'm sure you've noticed before that I'm a bit of a Manchester City fan. But I was reading something on one of the sites in Facebook, and I noticed that someone spotted someone having a heart attack, and they had heart disease themselves, so they carried aspirin with them. So they actually put 2 tablets under the tongue of the person having the heart attack, and the ambulance arrived. The person was taken to the hospital. They survived the heart attack, and they actually got a stent right away, which is the procedures nowadays. Whereas years ago it used to be you'd been brought into the hospital, had the clot bust, and then you'd have got the stent a couple of days after that. But the question we've got to ask is, can an aspirin stop a heart attack? I suppose in a way it's really how severe the blockage is. But for a lot of reading I've done, if you take like 300 ml of aspirin and you put 2 of the tablets under your tongue and suck on them, don't bite or swallow them, you actually suck on them, the aspirin will actually go down similar, well, not the same way that they would break a, obviously they've got better gear in a hospital, but the aspirin will make its way through that clot, because it does break down clots, the aspirin. So it's something I always do myself ever since I had the heart attack. I'll show you a wee thing here I bought on Amazon. This wee jobby here. Now this here, you just unscrew it like so, and my 2 aspirin are inside. So I always carry that with me. Now there's the two aspirin that are inside it. But what you've got to make sure is, that wherever you are, there's no point having it in that little container if the people that are near you when you're having a heart attack don't know. So whenever I'm in work, anybody I work with, they know that whenever I come into work, those keys are in my drawer. And if I was to have a heart attack, they would know the procedure to do. Open my drawer, open the container, get the 2 tablets, put them under my tongue. I'm also the member of a gymnasium, as I'm sure a lot of you are, but it's the same there as well. The people in the gym know that if I'm on a rowing machine or something like that, they're in a sort of collapse with a heart attack, they know to put the 2 tablets underneath my tongue. So the only thing I can say to you is, it's actually a good idea. This little device, only really cost me a couple of pounds, and luckily I've never had to use it yet. But I do know that aspirin can stop a heart attack. Well, it can't stop a heart attack. You'll still have a heart attack, but it can stop you dying. So for a couple of quid and the price of a couple of aspirin, job done. What do you think? Yeah?